Good morning or good afternoon, wherever you may be. My name is George Parasotto, and I am the Administrative Director of the Division of Workers' Compensation. And I'd like to welcome you to our educational webinar entitled California's Medical Treatment Utilization Schedule, also known as the MTUS. I'm glad you can join us today. This is the first of 2 educational webinars that we will be presenting. Our next educational webinar will be on the drug formulary. We anticipate the Office of Administrative Law approving the formulary regulations by December 7th, and we will hold the drug formulary webinar shortly thereafter. We hope you will find these webinars helpful as you prepare for the updates to the MTUS guidelines, which will become effective on December the 1st. And the new drug formulary regulations, which will become effective at the beginning of next year. For those unable to attend, the webinar slides will be posted online for on-demand viewing. So let's get started, and let me begin by introducing our Executive Medical Director, Dr. Raymond Meister.
Thanks, George, and welcome everyone. At the Division of Workers' Compensation, we establish policy and guidelines for the evaluation and treatment of injured workers. California law gives your patient the right to receive medical treatment that is reasonably necessary to cure or relieve from the effects of his or her work-related injury or condition. Treating providers in California's workers' compensation system are required to provide evidence-based medical treatment. This means treatments that have been scientifically proven to be effective. The MTUS provides the framework for the evaluation and treatment of California's workers. The MTUS includes a set of guidelines covering which treatments are effective for most work-related injuries or conditions. Our goal is that all clinicians who treat California's injured workers understand and follow the MTUS. Understanding and following the MTUS is not only required by law, but it will facilitate the approval of your treatment plans and improve the outcomes of your patients. Today's webinar, California's Medical Treatment Utilization Schedule, contains 2 parts. The first part of the webinar will be a thorough discussion of the MTUS. John Cortez, Industrial Relations Counsel for the DWC, and I will discuss why the MTUS is important and what it is, describe how to apply the MTUS medical evidence search sequence to find treatment recommendations, explain the clinical documentation requirements to get your treatment requests approved, and illustrate how utilization review, or UR, and independent medical review, or IMR, physicians apply the MTUS methodology for evaluating medical evidence. In the second part of this webinar, I will introduce Lucy Shannon from the Reed Group. Lucy will provide a demonstration of the available tools that we believe will make the entire process much easier and more efficient for treating providers, reviewing physicians, and others in the workers' comp system. So let me begin by introducing John Cortez.
Great. Thank you, Dr. Meister. So why is the MTUS important? The MTUS was developed to establish evidence-based, peer-reviewed, nationally recognized standards of care to guide the evaluation and treatment of injured workers. The core of the MTUS is its medical treatment guidelines. California law requires use of the MTUS treatment guidelines. California Labor Code Section 4600B states, medical treatment that is reasonably required to cure or relieve the injured worker means treatment that is based upon the guidelines adopted by the administrative director. In addition, Labor Code Section 4604.5A makes it clear that recommendations found in the MTUS guidelines are presumed correct on the issue of extent and scope of medical treatment. The term presumed correct means that recommendations found in the MTUS guidelines will automatically be applied to guide your patient's care unless you disagree with the recommendations and you wish to challenge it. Dr. Meister will discuss the details of how to challenge the MTUS's presumption of correctness later on in this presentation. The MTUS is important because it is the primary source of guidance for treating physicians and physician reviewers in California's workers' compensation system. The MTUS provides the pathway to providing appropriate patient care and getting treatment requests approved. So what is the MTUS? When most people think of the MTUS, they think of medical treatment guidelines. But it is more than that. The MTUS is a set of regulations that provide the clinician with an analytical framework for the evaluation and treatment of injured workers in the California workers' compensation system. It is found within the California Code of Regulations, Title 8, Sections 9792.20 through 9792.26. Again, the medical treatment guidelines are considered the core of the MTUS. However, in addition to medical treatment guidelines, the MTUS regulations provide definitions to terms, establishes the primary role of the medical guidelines in the MTUS for the evaluation and treatment of injured workers, provides a medical evidence search sequence when looking for treatment recommendations, and provides the methodology to use when evaluating conflicting recommendations. The MTUS is based on the principles of evidence-based medicine, or EBM for short. There are several elements you must consider when providing care to your patients. Practicing evidence-based medicine is an important part of this process. The MTUS is based on the principles of evidence-based medicine. EBM is not cookbook medicine, nor is it meant to cut costs or withhold treatments from patients. Evidence-based medicine is a systematic approach to making clinical decisions by using recommendations supported by the best available evidence and integrating it with your clinical expertise and your patient's values. Patient outcomes improve when an evidence-based approach is used. As I'm sure most of you are aware, the DWC recently made evidence-based updates to the MTUS. By Administrative Director Order, pursuant to Labor Code Section 5307.27a, we incorporated by reference the most recent American College of Occupational and Environmental Medicine's Medical Treatment Guidelines, or ACOM, into the MTUS. The AD order was signed and posted on the DWC's internet website on November 1st, 2017, and it is effective for all medical services rendered on or after December 1st, 2017. This slide contains a link where you can find the AD order, which includes the regulatory amendments made and hyperlinks to the updated ACOM guidelines. Now, before the completion of these recent updates, the MTUS still contained many guidelines from ACOM's second edition, published way back in 2004. We have now adopted the most recent ACOM guidelines into the MTUS. Many of the updated guidelines are directly replacing older guidelines, but with slightly different titles. For example, the Cervical and Thoracic Spine Disorders Guideline has replaced the Neck and Upper Back Complaints chapter. The Shoulder Disorders Guideline has replaced the Shoulder Complaints chapter. Please take a look at the list on this slide, which shows the titles of the updated ACOM guidelines, which are directly replacing their older counterparts. In addition to the updated guidelines that have directly replaced the older guidelines, we have added new ACOM guidelines into the MTUS. We have added the Hip and Groin Guideline, the Occupational Work-Related Asthma Guideline, and the Occupational Interstitial Lung Disease Guideline. Finally, we deleted the acupuncture medical treatment guidelines and the post-surgical treatment guidelines because these treatments are now addressed in the corresponding updated clinical topic guidelines and or the chronic pain guideline and or the opioids guideline. In other words, acupuncture and post-surgical treatments are being covered in all the other updated guidelines that we have now adopted. One important note, ACOM's updates to the stress-related conditions guideline is not yet ready for publication. However, psychological treatment and evaluations related to chronic pain is addressed in the chronic pain guideline. The DWC's temporary regulatory solution until ACOM completes its updates to the stress-related conditions guideline is as follows. For psychological treatment and evaluation related to chronic pain, the chronic pain guidelines shall be used. However, if the injured worker's psychological condition, treatment, or evaluation is unrelated to chronic pain, then medical care and evaluation shall be in accordance with other medical treatment guidelines or peer-reviewed studies found by applying the medical evidence search sequence set forth in the MTUS regulations in section 9792.21.1. So where can you find the MTUS guidelines? As previously mentioned, California law requires use of the MTUS to determine medical treatment that is reasonably necessary to cure or relieve the injured worker from the effects of his or her injury. Although the DWC has posted the updated ACOM guidelines incorporated by reference into the MTUS on our website, we posted it for rulemaking viewing purposes only. The ACOM guidelines are copyright protected. In fact, the ACOM guidelines posted on the DWC's website are secured PDF files. You can view them, but they cannot be printed, copied, pasted, or edited. Commercial use of the ACOM guidelines requires the purchase of a license from Reed Group, ACOM's publisher. We will provide more details about the purchase of a commercial license later on in this webinar. I will now hand it over to Dr. Ray Meister to explain the process when making a treatment request.
Thanks, John. I know that clinicians caring for California's injured workers want to provide the best care that is supported by the best available evidence. I know that many of you have your go-to treatments and that it takes time to learn new guidelines. As an OCMED physician, I understand some of the time constraints that you are all faced with. However, I believe that a bit of upfront time and effort to learn the rules around the MTUS and to become familiar with the new ACOM MTUS treatment guidelines applicable to your practice will benefit you and your patients, and that it is very likely that you will provide better care and save time and effort in the long run. Let me begin by introducing the medical evidence search sequence. Every workers' compensation clinician and reviewing physician should be familiar with it because it is a regulatory requirement that establishes the sequence or order that must be followed when conducting a medical evidence search. And if you want more information on this, you can see section 9792.21.1. The medical evidence search sequence is not a hierarchy of evidence. Finding a recommendation in any of the sources mentioned does not necessarily mean you must end your search. However, the search sequence was designed to make things more efficient and consistent for clinicians and medical reviewers by taking advantage of work that has already been done by guideline makers. Therefore, if the MTUS treatment guidelines address your patient's injury or condition, there is a good chance that those recommendations are supported by the best available evidence. As the medical evidence search sequence mandates always begin by searching in the MTUS guidelines. Now that the DWC has adopted the most recent ACOM guidelines, your patient's injury or condition will likely be addressed in the MTUS guidelines. Take a look at the yellow flowchart on the right-hand side of the slide. Ask yourself, is my patient's condition or injury addressed by an MTUS guideline? If the answer is yes, then ask yourself, does the recommendation found in the MTUS guidelines support my treatment request or treatment plan? If the care you wish to provide is supported by the MTUS guidelines, then simply apply the MTUS guideline recommendation to the treatment of your patient. There's no mystery to this. In fact, it can be a very simple process. However, let me emphasize, without proper documentation, your request for authorization or RFA can still be denied even if you followed this process. Proper documentation is the key to approval. Providing proper documentation that substantiates the need for your requested treatment is the most important step to getting your treatment requests approved. You must complete the doctor's first report, DFR, or progress report, PR2, and request for authorization, RFA, that includes the clinical rationale to substantiate the need for your requested treatment. The regulations do not require that you cite the MTUS guideline in the RFA if your treatment plan is supported by recommendations found in the MTUS treatment guidelines. However, the DWC recommends that you provide an MTUS guideline citation in your RFA to make it clear to a utilization reviewer that the recommendations found in the MTUS treatment guidelines support your treatment plan. Important caution here. Again, merely citing an MTUS guideline is not enough. Your treatment request could still be denied even if you've cited recommendations found in the MTUS guidelines, if you do not provide the relevant clinical details in your documentation. You can use the MTUS criteria as a guide for your clinical documentation. Your clinical documentation must support the use of that recommendation for that patient in that situation. To summarize, if your treatment plan is supported by recommendations found in the MTUS treatment guidelines and you've provided the proper clinical documentation, your request will most likely be approved. Remember, documentation is the key. Now we turn to the use of recommendations found outside of the MTUS guidelines for patient treatment. Here is a slide that shows the medical evidence search sequence again, but this time the treating provider is searching for treatment recommendations outside of the MTUS guidelines. There are only two limited situations that may warrant treatment based on recommendations found outside of the MTUS treatment guidelines. Take a look at the red box on the right-hand side of the slide. The first situation is when your patient's condition is not addressed in an MTUS guideline. The second situation is when your patient's medical condition is addressed in the MTUS guidelines, but the recommendations do not support your desired treatment plan. Recommendations found in the MTUS guidelines are presumed correct. So if you disagree with these recommendations, you may challenge them by finding recommendations outside of the MTUS that are supported with a higher level of evidence. Remember, as a treating physician, you bear the burden of proving the medical necessity of your treatment request. If you're challenging the MTUS, be prepared to take the extra steps. In both situations, you will need to find recommendations outside of the MTUS that support your treatment plan. In order for your treatment plan to be approved, the recommendation you find must be supported by the best available evidence. This slide shows the process to follow when making a treatment request supported by evidence found outside of the MTUS treatment guidelines. On the left-hand side of the slide, in blue, is a condensed version of the medical evidence search sequence. Here, the treating provider is searching for treatment recommendations outside of the MTUS guidelines because one of the two limited situations for searching outside of the MTUS treatment guidelines exists, as illustrated in the red box in the center. Once you have found a recommendation outside of the MTUS guidelines, follow the process illustrated in the yellow flowchart on the right-hand side of the slide. In order for your treatment plan to be approved, the recommendation you find must be supported by the best available evidence. However, how do you know if the recommendation you found is supported by the best available evidence? I'll discuss this process in a little while. Let me first cover the proper documentation as it pertains to treatment recommendations found outside of the MTUS treatment guidelines. To successfully challenge a recommendation found in the MTUS guidelines, treating physicians must cite recommendations supported with a higher level of evidence than that contained in the guidelines found in the MTUS. If you believe recommendations you found outside of the MTUS guidelines meet this criteria, then you must provide, first, a clear, concise statement in the RFA that the MTUS's presumption of correctness is being challenged. Number two, a citation to the guideline or study containing the recommendation you believe guides the proper medical treatment. Number three, a copy of that study or the relevant section of the guideline containing the recommendation you believe should guide treatment. And lastly, if more than one citation is noted, provide a copy of each with an explanation of how it provides additional information not addressed in the primary citation. If your patient's injury or condition is not covered by an MTUS guideline, then the documentary requirements are similar but simpler. For instance, you don't have to provide the clear and concise statement that the MTUS's presumption of correctness is being challenged. Also, a citation to the guideline or study containing the recommendation you believe guides proper treatment is not required, but we strongly recommend that you provide this. All right, we're going to move on to the next topic. What are the roles of utilization review and independent medical review physicians? Simply put, they determine if your treatment request is medically necessary. They are required to follow the analytical framework established by the MTUS to ensure that recommendations guiding patient care are supported by the best available evidence. Since recommendations found in the MTUS guidelines are presumed correct, UR and IMR physicians will first evaluate your treatment requests by determining if they are addressed by a guideline in the MTUS. Recall my previous comment. If your treatment plan is supported by a recommendation found in the MTUS treatment guidelines and you've provided the proper clinical documentation, your treatment request will most likely be approved. Again, remember, documentation is the key. However, things get a little more complicated when there are conflicting recommendations that could potentially guide your patient's care. Conflicting recommendations can occur when, one, recommendations in the MTUS guidelines do not support your desired treatment plan, and you've searched the medical literature and cited recommendations found outside of the MTUS. Or two, the MTUS guidelines do not address your patient's condition, and you found and cited recommendations outside of the MTUS guidelines. In this second scenario, since the MTUS guidelines are silent, both UR and IMR physicians are obligated to search the medical literature to find recommendations outside of the MTUS, and the recommendation they find may conflict with the recommendations that you found. UR and IMR physicians are required to apply the MTUS methodology for evaluating medical evidence to resolve conflicting recommendations. They are required to evaluate the quality and strength of the underlying studies used to support each recommendation and, if necessary, apply the MTUS hierarchy of evidence to determine which of the conflicting recommendations is supported by the best available evidence. That recommendation will then be used to determine the medical necessity of your requested treatment. Even though treating providers are not required to formally apply the MTUS methodology for evaluating medical evidence, it is important to understand this process. If you recall, I asked the question earlier, how do you know if the recommendation you found outside of the MTUS is supported by the best available evidence? The answer is by applying this methodology. I will not delve into the details of how to apply the MTUS methodology for evaluating medical evidence during this webinar. However, if you would like to learn more about this, you can go to California Code of Regulations, Section 9792, 5.25.1 for the details on the methodology and the hierarchy of evidence. Once UR and IMR physicians have determined which recommendation is supported by the best available evidence, they shall include the following in their decisions. Number one, a citation to the guideline or study containing the recommendation that guides medical treatment. Number two, the level of evidence for each published study shall be documented and included in the UR and IMR decisions. Number three, if more than one citation is noted, they will provide an explanation of how it provides additional information not addressed in the primary citation. And number four, finally, when relying on lower levels of evidence, a statement must be included that states higher levels of evidence are absent. So, to summarize, the MTUS is a set of regulations that provide an analytical framework for the evaluation and treatment of injured workers in the California's workers' compensation system. The recommendations found in the MTUS guidelines are presumed correct and provide a pathway for the most effective treatment for work-related conditions. Follow the medical evidence search sequence, which requires you to begin with the MTUS guidelines to determine if it contains a recommendation that addresses your patient's condition and supports your desired treatment plan. Proper documentation is the key to getting treatment plans approved. Remember, citing a recommendation from the MTUS is not enough by itself. Be sure that your clinical documentation supports the use of that recommendation for that patient in that situation. Failure to properly document the MTUS requirements may result in a denial. UR and IMR physicians determine if your treatment requests are medically necessary, and when there are conflicting recommendations, the MTUS methodology for evaluating medical evidence is applied to determine which recommendation is supported by the best available evidence. And finally, UR and IMR physicians must provide specific documentation to justify their decisions. At this point, I'd like to give just a very brief introduction to our formulary. As George mentioned at the beginning of this presentation, once the regulations are formally adopted and in place, we plan to have another series of webinars which will cover in detail the formulary regulations and our MTUS drug list. But let me just give you a real brief overview for those of you who may not have been following along with the development of the formulary. Our formulary is first and foremost evidence-based. The MTUS drug list is based on the ACOM formulary, which is in turn based on the ACOM treatment guidelines, which in turn are the MTUS treatment guidelines. So it was very important that we have an evidence-based formulary. We have added some additional rules and regulations to hopefully make this formulary work well for everyone here in California. We have designated certain medications as exempt from prospective utilization review as long as those medications are used consistent with the MTUS ACOM guidelines. We also have other categories of medication which are used in certain conditions. We have special fill medications and perioperative fill medications. And again, we'll go into all of these things in much more detail once we have final approval on our formulary. Before I hand things over to Lucy Shannon from the Reed Group, I wanted to cover when a license for the ACOM practice guidelines will be required. And just to make it clear, the ACOM practice guidelines are the MTUS guidelines now. So California requires the use of the MTUS guidelines for physicians treating workers' compensation patients. The MTUS is built on the foundation of the Reed Group's ACOM practice guidelines and formulary. Using the ACOM guidelines to treat patients or for UR and IMR decisions is considered a commercial use of the guidelines, and a commercial license from the Reed Group is required when providers use the ACOM guidelines for any of these commercial processes. California providers can currently obtain an annual commercial license to the ACOM guidelines and formulary at a discounted rate of $100 per year. The Reed Group has a website where you can go to take advantage of this offer. They have also made available Carlos Luna to answer any questions via email or phone. You know, I think that you will find Lucy's presentation very informative, and that you may find that some of these tools will simplify your use of the guidelines within the California's workers' compensation system. And so at this point, I'd like to turn the presentation over to Lucy Shannon, who will give us an online demonstration of the MD Guidelines website and specifically how to navigate the ACOM guidelines, which you will find there.
Thank you, Dr. Meister. We are getting connected right now to the MD Guidelines website, and I am going to get us back to the home page very quickly. For those of you that I haven't worked with or haven't met at the various conferences, my name is Lucy. I'm the Director of Editorial Research and Development for Reed Group. And in this role, I'm responsible for the content that we'll be looking at today. And my team specifically works on how to deliver that content through the site and in the tools that we'll be looking at in more detail. So users are required to have a subscription to this site, and it's been deeply discounted for providers in the state of California. Once a user logs in, this is the home page of the website that you'll be presented with. And we have a global toolbar here that you can access a number of tools that help to get to the content very quickly. The one that we'll be looking at today or spending most of our time with is called DART. And DART stands for Diagnosis and Related Treatments. All of the information that is in DART comes from the ACOM practice guidelines, which is the very same as the MTUS. So this is a tool that allows our users to access all of the recommendations very quickly, rather than navigating through the full text of the guidelines. But I do want to start there, showing you where the full text guidelines are and how to access those. So over on the right-hand side of the screen is a drop-down that's called Resources. And when I drop that down, the second choice that I have here is the ACOM practice guidelines. And when I click into that portion of the website, and I'm sorry, I'm experiencing a bit of a delay. When I click there, then I'm provided with some different access points to the guidelines, the first being the methodology. So this is a document that describes everything from who's involved in the guidelines, how we go about involving those folks. It discusses how we work with conflict of interest, how we report out on that information, and then how we score studies, inclusion and exclusion criteria. Really, it's the entire process, soup to nuts. It's very transparent, and we adhere to a number of different standards, including the Institute of Medicine's standards for creating trustworthy guidelines. We use agree to and grade methodologies, but all of that information would be found in this methodology document. The next link that we have is for the foundation guidelines. So these are educational in nature and discuss issues on prevention, initial assessment, how to use guidelines at the point of care, So all of that information can be found in the Foundation guidelines. Next are the disorder guidelines, and I'm going to go ahead and open up that link. All of the disorder guidelines have the date that they were last updated. So I don't want you to get confused when it says effective September 1st. All of the MTUS guidelines go into effective December 1st. When it's talking about effective date here, this was the date that the guideline was last updated. All of these guidelines are in the MTUS. All of them have the same dates. So I just want to make sure that everyone is really clear that everything that we're going to be looking at today is the MTUS. We are creating another part of the site. So I'm going to go back up to resources really quickly and click on that, that drop down again. I apologize because I am experiencing a bit of a delay here. What I am going to point out, if I'm able to open that, is that there is a link here to state guidelines. And when I click on state guidelines, then we'll see that there is a link to California, and there's a couple different options at this point. So we have the current version of the California MTUS. This would be the 2004 guidelines that are currently in place right now. When December 1st comes, we will archive these guidelines, so they'll still be available on the website if someone needed to access those. But the California, the 2017 proposed MTUS updates, this will become another way to access the California MTUS. So if I were to open this up, again, you're going to see the same thing where the dates match exactly what we were looking at. So I just wanted to point out there's a couple different ways to access this information. It can get a little bit confusing since California, refers to the guidelines as MTUS, and we've referred to them as ACOM. So I just want to make sure that we all know we're talking about the same thing. The next thing I'm going to do, I'm going to go ahead and open up a guideline and talk a little bit about how the guidelines are organized so that you can quickly get to the information that you're looking for. In this case, I went ahead and opened up the Handwritten Forum guideline, and I'm going to start right here with this summary of recommendations. So this is a table of all of the recommendations that are available in this particular guideline. It starts with acetaminophen, and this first one is for postoperative rehabilitation. We have information on acupuncture, but you can scroll down through all of the different topics and click into any of these in order to find that section in the guideline itself. So we can go ahead and I'll just go ahead and go into the guideline, and here is the information. Now that I'm in the section for this recommendation, if I do Control F and I look for acetaminophen, I'm going to go ahead and very quickly find where that recommendation is on that page. So that summary of recommendations table is a way to quickly navigate to recommendations in the guidelines. It's one way to get there. I want to point out that across the top we have some breadcrumbs. And what this allows users to do is to know exactly where they are in the guideline, but then also to use it as navigation. So if I want to go back to the highest level, the handwritten form, I could go ahead and click on that, and it's going to take me to that initial table of contents that we had been looking at, where we accessed the summary of recommendations. So another way to get at the treatment information or diagnostic intervention information is to come down to either of these links. So if we're looking for diagnostic recommendations, we could go ahead and click here. If we're looking for treatment recommendations, we can come here. I'm going to go ahead and click on the second link and then I'm presented with a number of different conditions that are covered in this guideline. I'm going to go ahead and choose carpal tunnel syndrome. And then these are all the different categories for which the recommendations reside. I'm going to click on injection therapies, and then I have all of the recommendations for injections within this guideline. So what I'm doing here is showing you how to navigate through the full text guideline in order to access the information that you're looking for. Now, keep in mind that the full text of these guidelines is anywhere from 500 to over 1,000 pages. So when I'm looking for the information, there's definitely, there's multiple clicks that I need to make in order to navigate myself to the appropriate information. Which is one of the reasons why we developed the tool that I mentioned earlier called DART. So at this point, I'm going to go ahead and open that tool, and I am able to start entering the diagnostic code that I'm looking for or the condition that I'm looking for. So whether I come in with 354.0, which is for carpal tunnel in ICD-9-CM, or G56.00, which is an ICD-10 CM code, or I can just go ahead and start typing carpal tunnel. All of those are ways to navigate to the recommendations for this particular topic. Next, I have a drop-down, and I am going to go ahead and do this. You can see that these are all the same categories that we saw when we were in the full text of the guideline. So there are recommendations for carpal tunnel syndrome in all of these different categories. But I want to be really clear, you don't have to select a category. I can leave this as any, and the next choice that I can make is regarding the phase of care. So at this point, I can indicate the individual that I'm seeing is in the acute phase of the injury, subacute, chronic, or if I need information on a surgical, which includes perioperative, postoperative, and preoperative information, then I could go ahead and click there. Again, I don't have to make a selection. I can leave it on all. And when I do that, all of the recommendations that are available in this particular guideline for carpal tunnel syndrome are available for me. So there's quite a bit here, and that's why these additional filters can help to narrow the focus. But you don't have to use it that way. You could, like I said, leave it as any, leave the phases all, and you can actually just come in here and start typing. So if I'm looking for information on physical or occupational therapy, I could come right here, and when I open it up, I have the information available to me. It includes the phases that this covers, the recommendation summary itself, the level of confidence for this particular recommendation, indications, frequency, dose, and duration information, the indications for discontinuation, the rationale, and the evidence summary. So it is giving us some really specific information here, but when I click on more, the full text of the recommendation is available for me. At the bottom, I'm going to take a minute just to talk about this evidence summary. So in this case, I can see that there are 13 moderate quality randomized controlled trials that have been incorporated into this particular recommendation, or are the basis for this recommendation. And if I am interested in looking at that evidence, I can go ahead and open up the link to the evidence table. And now all of the evidence, along with the score that it was given and a brief summary of the study, is available to me. So I can certainly scroll down through all of that information. So not everybody is going to want that level of information. I just wanted to point out that when it is needed, it is available from the DART tool. I'm going to go back up here, and I want to take you to injection therapy. So when I had been in the full-length guideline, this is a selection that I had made to find information on injections. I need to clear out the typing that I had done there. So now the category is injection therapy. All of the results are specific to injections. Again, when I open up this particular recommendation, it's the same information that I would be finding in the full-length guideline. It's the same thing that we saw when we navigated to that text. So again, DART is just a quick way to get to the recommendations in the guidelines. I do want to talk about this search box at the top of the page because we are going to be making some improvements very soon to the website, and it's actually announced right here. So currently, when users use this search bar, this is the diving board to all of the content that we have available on the website, not just the ACOM practice guidelines. So if a user were to type in carpal tunnel syndrome from this top box, they would be able to navigate to the content that we have on carpal tunnel syndrome. And I'm going to go ahead and do that because I want to point out that where we had alignment, we went ahead and brought in specific components from the ACOM guidelines. So anywhere that you see this ACOM logo appearing next to the text indicates that this information is coming directly from the practice guidelines. So in this case, these are the workflows or the algorithms that ACOM has created for, in this case, the initial evaluation of carpal tunnel syndrome, information on surgical considerations. What if my patient is slow to recover? There's additional algorithms to step providers through the considerations that they would want to make in helping that patient to recover. I'm going to quickly go down to diagnosis because that's another section that has the ACOM logo next to it. If I were to go down here to the medical history questionnaire, again, this is ACOM component, and all of the questionnaire the questions, that are specific to hand-wrist-and-forearm disorders are available here. So this search box currently will take you into our content, and there'll be portions of it where appropriate that will incorporate the ACOM practice guidelines. But again, what I wanted to point out was that this weekend we'll be rolling out an update to this search functionality that will actually allow you to be more focused in that search box, so that if you are just looking for ACOM information, you'll be able to see those results, or to specify that you're only looking for information from the ACOM practice guidelines. So that is an improvement, again, that we will be making this weekend. So other improvements that I want to talk about that will be coming soon, so they will be released before the end of the year, have to do with the DART tool. So in DART, right now, when we were looking at carpal tunnel syndrome, there aren't any links back to the full text of the guidelines. So we're bringing that text into DART, but we're not giving you a link back into the full text. And with this next update that we do in December, we will actually be providing those types of links that go back and forth. So, for example, if I were in the topic of low back pain, and I click go, and for example, I may be interested in information on, let's say, yoga. I can go ahead and type that in. When I expand this first recommendation here, there is a reference at the very bottom, and it says URL to full text. So if I go ahead and click on that, it's going to take me right back into the full text of the particular guideline that recommendation in DART is coming from. So then I can go ahead and navigate myself right down to that particular recommendation entry. So that linking is being done now. We're rolling it out as we go, and it will be complete for all of the different topics in mid-December. And then lastly, I want to mention that with DART, we are also going to be making a change to how, or providing another option for searching for information in DART. So right now, users need to come in with a medical code or the name of a topic. However, in the next update that we'll do, you will be able to search by a treatment name. So for example, just like we were looking for yoga information in low back, I could go ahead and come in with yoga, or if I needed information on acupuncture, I could go ahead and enter that terminology, and it's going to go ahead and show me where in the guidelines that information is found, and then take me to those particular recommendations. So that will be coming later this year. I think that is all. Actually, there's a couple more things that I want to make sure that I talk about. I'm going to bring back up really quickly carpal tunnel syndrome. I want to make sure that everybody understands there's information on devices in the guideline. There's information on rehabilitation programs, information, the recommendations on medications. All of that information is found in this guideline. So this particular drop-down category is fairly helpful in determining information that's available. But I did want to point that out. When it comes to post-surgical information, there are a couple ways to get to that. I could just come to the guideline. I don't have to specify a category. I don't have to specify a phase. I could just start typing post-operative, and I am going to get a number of results for that information. I could also say that the phase was surgical, and get to the recommendations that way. So lots of different ways to get to that post-operative information for users. With that, I am going to turn this back over to Dr. Meister, and we'll go from there.
Great. Thanks, Lucy. This is probably a good place to end this webinar, and a good note to end it on. So we'd really like to thank everyone for attending today. We'll go ahead and wrap it up there.
Thank you very much, everyone.